you, Michele. So, hello, everybody. Good morning, good afternoon, and good evening. I'm happy to present some of the work that we do at the United Nations around the use of AI and machine learning and data in general in the response to the pandemic. So I work for UN Global Pulse, which is the innovation initiative around data and artificial intelligence of the UN Secretary General. And we have a network of innovation labs in 4 countries, in New York quarters, in Uganda, in Kampala, in Jakarta, and Indonesia, and recently we opened in Finland. And what we try to do is to really incorporate new methodologies around data science and AI into operations, really like trying to bridge in the gap from research to actual use on the ground to support UN agencies and member states. So I mean, during, as I guess that everybody that was able to do it during this pandemic, all our team has been, working remotely from different parts of the world. We are really proud to have been, working and connected really from every continent and trying to support our colleagues. So I guess that just to give a little bit of context of how we work, typically we partner with one international organization, one UN agency that has a particular problem. Okay, and in this case, I guess that the obvious partners were around health, but as we know, the pandemic has impacted many dimensions, and we try to incorporate new ideas and give space to really to innovate, to find like the right data, the right tools, the right expertise, find like external partners, do projects and apply them and share them with the rest of the world. So when we think about, the type of impact we want to have, I always put these 3 layers of impact. I think it's important to understand the picture. So one is methodological impact. That is what, when we do research, is what academics typically do. Another is operational impact, and that's something that many researchers has transitioned during the pandemic. So in real time, you are applying the innovations or the discoveries or the science you are doing to try to respond. And there is a 3rd layer of impact, which is ecosystem impact, which is, how you can help like set up the agenda, how you can help influence others, how you can help send signals to the ecosystem of what is important and what is like interesting to do. So during this pandemic, when at the beginning, in February, March, one of the first things that our team started to do, it was really see where we could help. Okay, so at the UN, we created what's called the Crisis Insights team, and essentially we were supporting different agencies at international and national level. And we had a number of initiatives. Today I'm going to just talk a little bit about one of the first things that we did, which was like mapping the landscape, mapping like the opportunities that AI or machine learning had, but also I will go down to 2 particular projects we have been working on, which has to do with modeling epidemics and infodemics in a particularly challenging context where, we, based on requirements from the partners, we thought that we could help. So just back on the mapping, and so in February and March last year, we started to go extensively through all the research that had been published, both, at COVID was like really early times, but also like similar things, trying to have a big picture view of which were the options to actually, or the possibilities actually to help the community see where they could fit. Okay? And it was interesting because at the beginning we were talking about in the dozens or hundreds of articles. But what we have seen is that, we also had some sort of infodemic in the scientific sphere. It's like thousands of preprints, thousands of peer-reviewed articles. Really, we're talking about in the peak, as this tweet said, more than 600 articles per week. But also something that I find interesting is that looking for the follow-up of this tweet, it seems that we have reached some R equal 1, so we had some sort of stability, and still today we are having more than 500 papers around COVID every week. Many of them are related to computational techniques like AI and so on. So the intent, I mean, I'm not going to go in detail in any of the applications, because I mean, even this morning we have already seen 3 different layers, but essentially what we did and the way we have organized the different applications is depending on the scale they work. Okay, so we had some applications at the scale, at the molecular scale. We just seen the previous talk. I mean, this is something that requires time, but it's clear that AI has a role on like understanding protein folding structures, helping like drug discovery or drug repurposing, or even like in vaccine discovery. So that was like one layer, one sort of applications. The next scale, and we also have seen 2 talks ago examples, it was about the clinical scale. This one is particularly challenging because really it requires to have clinicians and technologies and AI experts really working together. And we have seen examples. I mean, the first, I guess that the ones that we had most number of publications was around medical imaging, was about like using either CT scans or X-rays and to detect symptoms of pneumonia in lungs, and detecting that or supporting that detection automatically by AI algorithm. In this, I mean, there has been dozens of publications around this area. It's true that most of them didn't have the right design or the right clinical evaluation performance. There were many biases on the data sets, really like using a very small data set with not enough data quality, not enough variances around the populations and so on. Still is some techniques that have been applied in particular places, in particular moments of the pandemic, very successful. There are other interesting research also with non-invasive measurements, like using like things like your Fitbit or like remote any wearable that can give signals and early warnings. There has been modelizations, as we have seen, at the individual patient level, at the hospital level, or even at the regional level. I mean, thinking how to optimize the use of intensive bed cares. And then there's another area which also was really has been like steadily going up, which is the use of robotics. I mean, obviously like telemedicine, but also robotics, and even robotics for things like cleaning. Okay, so even similar to disinfecting robots, that has been quite an interesting application. So for me, it was like we have molecular scale, we have clinical scale, and then we have large scale, societal scale. And in this case, we divide the applications on 2 fronts. On the one hand is more classical epidemiology. I mean, we have seen examples of how to use any sort of big data to model mobility, to forecast or predict infections, to model non-pharmaceutical interventions. Also in places where we have a viral data, we have seen that sometimes data-intensive techniques are even more useful than those that use just pre-design equations and simplified models, or even like contact tracing systems. So I guess that area has been probably the one that more efforts have been put on. And then there is another area which I know that this afternoon we will have a number of talks, which is what has become the other epidemic, which is epidemiology. And here there are all sorts of applications, but I mean, essentially mis and disinformation are traveling really fast on the social media, on the media, are having an impact on populations, are having an impact on our intentions and our behaviors. And there are obviously many research applications in this context. So we can try to understand how these rumors are propagating. We can automatically detect these rumors. There are applications around like hate speech, xenophobia, stigma. We saw it at the early days of the pandemic around Asiatic populations, but we have seen how these have been shifting all around. There is also a way to use these techniques to promote positive messages and really understand what's going on. And even the scientists, we have done an exercise. There are many examples of given that we have more than 500 papers per week, we need ways to understand what is there, to categorize, to really be up to speed with science. So, I mean, I guess that these three scales, and with like fourth or three-fourth scales, has been a coherent way to structure essentially almost all the applications that have came up over the last year. It's true that the landscape has evolved. Still, we have some common considerations, which I guess that go with all the examples. So the first consideration that it sounds trivial, but it's real reality that these are highly multidisciplinary applications, especially when you want to go to implement them and require real partnerships. And this means trust and a common language. And both things, trust and a common language, are things that are not win overnight. Okay, so really, we have seen the teams that have that trust connection and really with different levels, not just particularly with policy making, can make it faster and may have like a bigger impact. We have seen, and I guess that this is common, that data sharing is hyper fragmented and local. There are all sorts of data sets going around. This is good in some from some perspective. I mean, I guess this provides a lot of resilience. This also helps taking measures really at local level. We have seen the example for the region of Valencia with Nuria, but also this poses some problems when you want to extrapolate to other places. Obviously, I mean, the data governance challenges, and in particular when we are talking about clinical data, has been are crucial. In fact, when you look at the scales, the molecular level scale typically is governed by the industry. So really, when you go down, you end up in industrial secrets. The second level, which is like the clinical one, this one requires quite complex data governance, and it's hard to make it on the fly. And the third one, which is societal scale, this is closer to what is statistics. So I think it has been easier to handle. Then, as we mentioned, because we need to pass from research to implementation, that is the reality that very few operational like tools have been deployed. Many times, those attempts have not checked rigorously, like data privacy, ethics, or even human rights. I mean, there are. I guess that's important. Before every project, you need to do a proper assessment of potential risk and harms to balance with benefits. And also, one of the interesting points is that some of it's not easy to pass from one solution to the same solution in a different place because the context is different. So how to adapt those global solutions to local ones, it's quite challenging. I mean, one example when we're talking about like X-ray analysis to find pneumonia caused by COVID, what happens when you pass that algorithm in a place where you have high prevalence of tuberculosis? So maybe you're going to get a lot of false positives. So really, you need to understand the context, and that requires international cooperation. And the last point, which we're going to essentially go into, we're going to use it to go into the examples that we have been working on, is that perhaps the use of technology in this case also is not reducing but increasing inequality. So the reality is that from data, I mean, visibility to like bias, the use of methods, algorithms. I mean, we are seeing many examples where people can be left behind or inequalities can be increased. I mean, even when we're talking about digital contact tracing, what happens with those that do not have, I mean, access to that contact tracing? I mean, this is the case when it works. We're talking about X-ray or CT scan analysis. If the initial data sets was like with pictures of particular demographic, maybe the other is left behind. When we are talking about algorithms that govern how the distribution of vaccines is done, that also might be creating inequality. So really, that's I think it's a very important and relevant topic. The examples I wanted to share with you about like projects we have been doing. It's the first one is around infodemics, okay? And as we were saying, this is like maybe the last is the first infodemic that we have in human history. So 1 year ago, member states, the governments of the world gave the World Health Organization also the mandate to work on infodemics. And the World Health Organization created a research agenda that many of us has been like trying to contribute and follow on which will be the steps or how we can help fight the infodemics. So one of the projects we had is that most of the effort to monitor social talks or social concerns are using like social media mining, like Twitter mining or other traditional media. So what we are working on is monitoring like disinformation and misinformation in radio stations, in online radio stations. So I mean, why? Because still many countries of the world, many people in the world get information from radio stations and community radio stations. We are talking about almost 50,000 stations, like covering 80% of the households. And essentially, when we think about the radio, we have to think also about the languages. And the reality is that just very few languages in the world are digitized. So here we are talking that there are around 7,000 languages in the world, and there are less than 100 which are properly digitized. So everyone else, which is not one of the speakers of these privileged languages, they are essentially their voice is not here. So our intention also is to include those voices, to make sure that no voice is left behind, and use that to capture signals or patterns on COVID-related discussions or vaccine-related discussions. So this builds on a work we have been doing for the past years in countries like Uganda. And essentially, the concept of the pipeline is that we are first taking just in public radio stations. They can be online. Then we are passing a speech-to-text technology. This one is available in a particular number of languages, but for other languages or other accents, it doesn't work very well. Then we have to select the content. We have taxonomies. We have multiple ways to do it, and then a last layer on analytics. And this is essentially like creating a Twitter feed for COVID for radio streams. Essentially, we are taking 5 minutes of radio stream. We are transcribing them and looking for segments that talk about COVID or vaccines or similar things. So in this example, out of more than 500 hours of radio streaming, we found 7 hours of radio data that was talking about relevant issues for COVID. And this is then used projects in collaboration with the World Health Organization and different ministries of health, particularly in the African country. So then you hear things like, would I turn down the vaccine or not? Or what are the rumors that are going on? Obviously, what you hear is not always what you get, and this is one of the challenges for the machine learning community. As we have said, it's easy for someone in Spain, Switzerland, or the US to speak to their phone, and they will transcribe. But it's not so easy for someone that lives in a different country in Africa, where even the use of English or French is with a particular accent. It doesn't work. Okay, so here is not just the viable number of languages, but also is like their pertinence and the fact that they can get accents or not. But it's not that. We have found that even the most advanced neural network transformers or like all the AI models for language, they are not adapted to COVID times. How you use the word mask in literature or like in news corpus that were used to train the models 3 years ago, it's not how they should look like today. So really, there is, as language is in constant evolution, it has evolved also in terms related to COVID. And I think it's important to start to refresh at least those models. So, I mean, some of the things we found is local remedies which are proposed for curing COVID. So there are a lot of conversations, for instance, about this COVID organics drink that were supposed to cure COVID, mainly in Madagascar, or we can use this to understand rumors around clots, in this case where the discussions in Europe around AstraZeneca begin. Like a few days later, we saw them coming in South Africa, in different cities, in different ways. Okay, and this helps you tailor your messages from a public communications perspective and advocacy, and this helps WHO also like craft their messages. Now, what we are doing right now, we have a tool which is in form of dashboard that will be piloted by a number of countries at the same time during this summer to really understand how this can work really at the scale. I mean, it's beyond like social media monitoring, radio monitoring. It has different inherent nature of the radio data and how this can be used to take decisions in terms of how we are communicating the pandemic. Then another example of project we have worked on where we thought there was something important to do is around epidemic modeling in refugee camps and IDP settlements. So as crazy as it sounds, but there are more than 80 million people in the world that has been forced to flee their home. And these 80 million people, many of them are living in camps or in settlements, sometimes in their own countries, sometimes outside. And if you do a search on PubMed on the numbers of papers on epidemic modeling, you will have in the dozens of thousands. When you look at the number of works devoted to these populations, we are talking less than 10 peer review. So we have done two things. We have started to create a community around these challenges, but also we have been working since March last year with the biggest refugee camp in the world, which is Cox's Bazar in Bangladesh. This is home of 700,000 people, even more, the Rohingyas. And we have been working with the camp, trying to create a tool to simulate potential policy interventions. So this was the idea. I mean, this has been like a broad collaboration, obviously with our team, with the teams in Cox's Bazar, so UNHCR in charge of like the camp, the WHO in charge of providing health services, with other UN agency for emergencies, OCHA, with Durham University, and with a team from IBM and MIT. And the idea has been to create a computational tool which allows to simulate those policy interventions. So this, essentially this work also has been an adaptation of one of the models that have been using in the UK. Okay, so really we also wanted to have like the best possible tools also deployed in this very challenging situation. I mean, how we have done this? I mean, what we have done is a agent-based model. Essentially, we are simulating the camp. We have built a digital twin of the camp, both with geography and demography. We have done this together with the camp staff. We have a build simulation of models where we are like simulating the different interactions. With that, we provide insights of different scenarios depending on the policy measures they want to take, and getting feedback from them and also from external experts. So we have prepared the tool, and we continue to provide a number of recommendations on which would be like from a modeling perspective the next steps. So just coming back here to the camp, as we have said, this is more than 700,000 people really living in a very dense environment, highly populated. And what we did really is we put the exact geography of the camp in our model, where we have tried to simulate like everything that was viable. So essentially, there was like a lot of structural like places, like schools, community centers. Really, we have done a very extensive modeling exercise. Also, we in this digital twin, in this geography, we have done a multi-agent simulation where we have simulated every individual we have, based on the viable census, we have simulated the demographics of the different places. We have simulated how the households are organized, even inside the same shelter. Sometimes you have two households, and we have modeled the life of the people in the camp according to like the feedback provided from our teams on the ground. Really, what are the typical days? So based on that, we had our setup ready, and I mean, we were able to model in a very, very detailed way, even, I mean, how this is progression, really depending on the pathways that the health system is following. And I mean, after, let's say that, I mean, after creating that, what we have been providing is regular reports to the camp. So, for instance, one report was around is this, I mean, mask wearing policies, what could be the impact, what could be the recommendations, how many people, I mean, what is percentage that we need for mask wearing? I mean, is this worthwhile providing very good masks to few people, or like less good masks to like a whole people? Do the company to organize a particular communication campaign around masks? We have also been exploring ways to open the schools and learning centers. Shall they open as normal? Shall they like do shifts? I mean, we are modeling also, I mean, potential strategies for vaccine distribution. And something, I mean, interesting, I guess something critical is that there are many also strategic communication challenges. So something that we have learned, I mean, and we know, is that, I mean, you really also need to count with the community. We have also create a dashboard, like some visualizations that allow the experts in the camp that are taking the decisions to play with the different numbers, to play with the different scenarios, to play with the different simulations. So really, it's, I think it's really, this goes in line with what our colleague Nuria was saying before. I think this goes in line with the fact, which is not just like the modelers, then you need to have the public health experts and those decision makers all in the same team, all in the same chain. And this is that moment where you start to have opportunity to really have an impact. So yes, I mean, here you have like the paper soon to be accepted. Now it's in preprint. We have also been working in another paper that we will publish soon, trying to map the challenges for this community. Okay, because as we have seen, I mean, these contexts are not easy. So data, even though geographical and demographic data is quite good. For instance, in this case, the health data it's much more limited that you could have in a place like Italy or Switzerland, obviously. And then the models might need to account for different things. For instance, one example in our case, which is an agent-based model, is that we were able to model how the shelters and the households are distributed in this camp, which is quite different to, I mean, what you would find in a different place. Also, the different places where, or the different ways of mobility, they might not work as usual, even the different options that we have for treatment. Partnerships, as we said, is critical, and with partnerships comes trust, then communications, really informing even the community leaders of which are the options, how these models are working, or really has been key. And I mean, that's obvious, but in this case, the socio-political context is really important. I mean, when you are talking about places that can be in regions or conflict, or places where like national governments may provide limited support, this is where, I mean, you need to understand very well all the potential risks and harms, and put extra effort also around privacy, things like privacy, things like, I mean, what can really go wrong. But really, again, I guess that this is really an underserved research area. As I said, I mean, 80 million people and flee their home, and just a dozen of research teams are working in the world around this challenge. Just coming back, David, to one of the previous slides of the considerations we found at the beginning of our mapping exercise. It's, as mentioned, trust and common language. So we really need to create these multidisciplinary teams. Then, I mean, data sharing, the data sharing is critical. Sometimes you need to create the data, but you really need also to understand how the governance of this data is. And it's not the same. Again, you are talking about pharmaceuticals and drugs, but you are talking about clinical data. You are talking about aggregated large-scale public data. So all these things, they all have their own challenges. They all have their own potential risks or harms that you need to understand what is the model. And we have seen that many of the failures came from trying to get in one of these fields without understanding even the regulatory or legal landscapes. I mean, I guess that here we have accelerated, that's clear, like the rate of innovation. I think more and more AI innovations will reach operational application. And just to finish, I think that this is also a call for collaborators, for international collaboration. I will be really happy to work with other researchers and other teams that want to apply the lessons learned in other challenges, in other global challenges, because I mean, as we have seen, the pandemic is not over. I mean, there are many countries that are facing now the worst moments of the pandemic, and I guess that we need to make sure that all the technologies that we can use are fit for purpose. I mean, they are used if they are useful. I mean, and not it's noise, but also they are adapted and they do not like increase inequality. So I mean, thank you very much, and happy to take any question.
Thank you, Miguel. Thanks a lot for a very insightful talk. And we have now a few minutes for questions. And I would like to start asking you. So the same question I asked Nuria, actually, as you said, the pandemic is not over yet, of course. Do you think that now we are, after the experience with the COVID-19 pandemic, we are now in a better position to face a future pandemic or similar health emergencies, especially considering the vulnerable communities that are those your work has been mainly targeted at, which is the very, very important part that are usually, as you mentioned, underrepresented in the research community. So are we now in a better position to face future threats in terms of data sharing, of understanding the importance of these tools and put them at work in practice with policymaking?
So, I mean, I guess that's obvious that we are in a better position. I mean, I guess that's clear. And there has been, I mean, examples, like as Nuria was pointing, really examples where like public administrations have managed to use data one way or another. I do think that it has not been, I mean, optimal the way we have used these data insights and AI insights. Somehow, I think it was a little bit early. It's true that scientific collaboration as a whole has been incredible. It's like how vaccines have evolved, how treatments, how much we have learned from the disease in very few months. On the data space, I think we have realized which are the challenges, and we are better equipped and in better position to use them. And I think that's going to happen in all or in most developed countries. What we have to see is whether these tools will go and be adapted and applied to other geographies. I mean, to other middle and low income countries, which might be like far away. So I think the same way with vaccines, we have not been very, let's say, fair, or really, I mean, we are talking about dates for vaccination for many countries for like 2 years or things like that. I mean, I think we need we need to accelerate the technology transfer or the mechanisms to adapt all what we are learning in most advanced economies around like data sharing, applications, and so on. So I think we are in that point where it may happen that at the global level, we increase inequality in this digitalization space, or will really help to close the gap. So the same way I'm optimistic for the most developed countries, I think we also need to make all an effort to make sure that this gain is for everybody.
Yeah, thank you. That's very clear. And I'm also thinking of how can we also increase the interest of the scientific community towards working in this area? Because I think, yeah, as you mentioned, there is a digital gap in a sense to be filled, but also probably a lack somehow of interest maybe from the research community itself of working in the area of modeling and data science for vulnerable communities. And do you think there could be a more like global strategy to increase this interest and to attract the efforts of research groups to tackle these issues?
Yeah, I mean, I guess that this can work also at multiple levels. So, I mean, there are very, I guess, for the very young researchers or not so young researchers, there are, I mean, many ways they can get involved. They can go to, I mean, team to see pages or to work with teams like mine, work with teams like UNICEF. There are many universities that they are launching their programs for AI for social impact. There are also fantastic teams in many countries on the global south that are doing really good research, where I think more exchanges with those universities or those research centers would be good, because both sides will gain for that. So then at the, let's say, research community institutional level, I think in a global level, we researchers need to find also global problems. And now we have realized with pandemic that we are, I mean, that we are part of the same world. And I think somehow we need to put more visibility on those challenges, which many times go beyond like recommendation systems for advertisement. I guess that probably many, I mean, the scope of the challenges has been narrow. And now it's time to look broader, and that can be done at the institutional level. I think that many, and again, it's not just working with other countries, but we're talking also working, I mean, for the whole population. So really, it's programs around using AI for social impact, is around creating social enterprises, is around measuring how good you do, not just by the money that you do, but the impact that you have in health, in food, in many other things. So I guess that is a way of living, a way of thinking that I hope from academia, I mean, as professors, that we can help that more. And then there is a third level, and this is like a policy level, international level. I think, I mean, at least from the UN, the Secretary General is putting a big effort in the future in digital cooperation, because as we have seen, the digital layer is, the digital world is here, is part of the normal world. And really, countries are now realized that the same way they have collaborated, I mean, now we need digital international cooperation. So, I mean, efforts like, for instance, like now member states are approving shared AI ethical principles under the flag of, I mean, under convention from UNESCO. That is really interesting. It's really the world is going together, in this case, around the principles for AI. It's true that different countries, different politics have their different takes, but what this means also is that we as humanity have understood that we need to set up the right principles for the revolution that we are living, and now is the moment. So I guess that at institutional level, really high international level, at institutional academic researcher level, and individual, each of us can have now ways to really work and give more visibility to this type of challenges.
Thank you very much. Thanks, Miguel, for reminding us that the pandemic is a real a global issue, and with a lot of problems open all around the world. And so thank you again for your presentation.